Good morning, everyone. Welcome to your Chamber Live event this morning, delivered in partnership with Coventry City Council. Before we make a start on the event, just a little bit of Zoom housekeeping. So firstly, just to say we are going to be recording this morning's event, as we've had a few people who aren't able to join us. So we will record it and make it available online. So if you're more comfortable turning your cameras off for the recording, then that's absolutely fine. I'll give you a moment to do that. If we could just ask that you keep yourself on mute during the presentations, just so we avoid any unnecessary background noise and we can hear our presenters clearly, that would be much appreciated. And it is going to be an interactive session this morning, so the chat box is open. So as we go through this morning's presentation, if you've got any questions, thoughts, comments, anything you want to ask, then please do pop a note into the chat box, which you'll find in the toolbar at the bottom of your screen. So if you've got anything you want to ask or go through for any of the team on the call this morning, then please do pop that in the chat box and we'll come to questions after the presentation. So I'm just going to share my screen. And hopefully you will all be able to see that. So this morning's Chamber Live event, we're delighted to be delivering in partnership with our colleagues over at Coventry City Council, both from the public health team and also from the business team. And as many of you will know, we are starting to see a lifting of some of the national restrictions which have been in place from January. We saw the first sort of stage of that on Monday of this week, the 29th of March, where we're now allowed to meet with up to 6 people or 2 households outdoors, and the start of the reopening of some of our outdoor sports activity as well. So we're starting to see the roadmap coming to fruition as we move out of the national restrictions. So this morning, as I say, we're joined by our public health colleagues and our business colleagues from the City Council, and the next significant step really is the 12th of April. And in preparation for that, as businesses across Coventry and Warwickshire start thinking about reopening and those procedures and processes that they might need to put in place in order to make their business COVID secure, we're going to look at some of the advice, the guidance and the practical considerations this morning as businesses begin to look at reopening. So let's just have a look at what we're going to cover this morning. So we're joined by Liz Galton, our Director of Public Health at Coventry City Council, and colleagues as well. So we're going to have an introduction and overview of where we are at the moment, the current situation and where we are currently. We're then going to look at how to be COVID secure for both staff in the workplace and also for customers who might be visiting your premises. We're going to look at guidance to support your reopening and examples of what to consider. There's going to be some information on the access available to testing and also some of the resources that are available to support businesses across Coventry. And then we're also going to look at what business support is available. So some of those COVID grants that are available to our businesses and also the wider business support landscape as well. And then, as I say, at the end, if you have got questions, thoughts, comments that you want to ask the team, then obviously we'll be able to take those from you. So do please share those via the chat box. We want it to be a nice interactive session this morning. So please do get involved and put any questions that you might have through the chat box. So that's enough from me. I'm now going to hand you over to our Director of Public Health, Liz, to kick off our first part of the presentation this morning. So across to you, Liz.
Thanks, Chris, and hi to everybody. Lovely to see everybody. I'm Liz Galton. I'm Director of Public Health at the City Council. So I'm joined today by a number of my team. Sue Frossell, who is a public health consultant who's done most of the work leading with businesses, and then Karen, who's our programme manager for Test and Trace COVID, and then Dawn and colleagues from our environmental health Test and Trace team. So between us, I think you've got a really good rounded view of how we've worked with businesses around Test and Trace and indeed around COVID secure settings. So can we go on to the next slide, Chris? Thank you. So first thing I wanted to say was just a really big thank you to all the businesses in the city. it's been such a challenging time, just in terms of people's, obviously in terms of the economy, in terms of people's business, financial, but also just in terms of keeping people safe and well. And I realise how stressful that has been for business leaders. So so a really big thank you. So I don't know, where I'm sitting. Oh, I can move. You can move me so you can see the data on the other side of the screen, which is good. So I'm just going to give you a little bit of data to start, to give you in context. And I know you see this all the time, those of you that watch the news, in terms of where we are COVID wise, but this is Coventry specific, so it may be worth spending a minute or two on, because it may be interesting. And this is what we call our epi curve. And when you see at the high numbers there in the dark purple, that was where we were in January in terms of case numbers, and we've now dropped right down. It says 44 for the latest data on the slide. I think that was slightly incomplete data. It's probably nearer 53, but good enough to say that we're stabilizing at around 50 cases per 100,000, which is you know, is really good going really for the city. So again, thanks to all the businesses that contributed in keeping COVID safe there. Hospital admissions, so in the city, this is UHCW data as of 2 days ago. This has actually come down a little bit since this slide was prepared. There was 40 people with COVID in hospital and 9 in ITU. These are against numbers of, say, 250 in January. So again, much less pressure on the NHS. And I'm sure you're all interested in vaccination rollout. As of a couple of days ago, we'd vaccinated 142,000 adults in the city with first dose. That's around 48% of those 18 plus. So again, you'll hear on the media people saying over 50% of adults in the country have been vaccinated. Now, we're slightly lower in Coventry, not least because of our age profile. We're a young city, so the people that we have who are eligible, i.e. those that are 50 plus, is a slightly smaller cohort than say an older place such as, say, South Warwickshire. And also we do have some communities in the city that are still vaccine hesitant, and we're working really hard to encourage some of those communities to make sure they're vaccinated. So you'll be pleased to know that's it on data. I've just got one more slide, Chris, before I hand over to Sue. So this is a sort of a bit of a potted story of how we move from where we are now to where we hope we'll be in the summer. So on the left of the screen, you can see the dates, the indicative dates that have been set nationally. 29th of March was a couple of days ago. So rule of 6 or 2 households outdoors, outdoor sports events, journey. You can travel wherever, but you need to minimise your journeys. Think about your journeys. Everything I'm picking up nationally tells me that we're on track for the 12th of April for non-essential retail, outdoor hospitality, domestic overnight stays in self-contained accommodation. So there is no concerns I'm picking up nationally in terms of that 12th of April date. Clearly no decision will be made on the 17th of May or the 21st of June dates until nearer the time. But so far all is going as planned, I would say. The highest case rates are in school age children, but we're testing, God love them, we're testing them an awful lot, so we're picking up cases there. And in order to reach those next milestones, there's some things that we've been set nationally. So we have to see a low rate of transmission, decreasing in hospitalisation and deaths. I've just talked to you about that. Vaccination rollout, supply uptake needs to continue to be strong. We know that the moving down the age cohorts to those under 50 will be paused in April, because vaccine supply, the word we're using is lumpy, will become a little bit lumpy, but there's certainly enough vaccination to do second doses for those of us that are over 50 or high risk health and care workers or long-term conditions, etc. The vaccine seems to be performing, holding well, and the measures around new variants seems to be working well as well. So we know that when we reach a new milestone, we will see a slight increase in cases, such as we're seeing with school-aged children at the moment. That's probably okay, as long as you know, we're not seeing the hospital admissions going up, etc. And just to say, there's a lot of planning at a local authority level with NHS partners in terms of things called local outbreak management plans, to make sure we've got a plan going forward so that we can plan for the next 6 to 9 months. And that plan is in final draft and will be public within the next couple of weeks. So I'm going to stop there and hand over to Sue, but I'll stay on the call till the end and happy to chip in with any questions as we get to that bit. So thanks. Over to you, Sue.
Okay, hi everybody. Pleasure to be here. And would you mind putting forward the next slide, Chris? Thank you. I'd echo Liz's comments about our appreciation of the difficult time that businesses have had over this last year or more. And especially, I don't know how many of you who are on the call who have actually had to be closed. And again, really difficult time for you. Financial impact is completely, appreciated and understood, and you have our, kind of empathy in all that. But on top of that, we're entering a period of hope, aren't we? When we're hoping that we have some semblance of normality going forward in the future. So a little bit about the public health and business support that we've been providing over the last year or so. So engaging positively with businesses, and one of the messages that my team members will have heard me say many times is that we really try to approach this in a completely supportive way rather than a kind of, we're inspecting you kind of way. So it's a win-win kind of approach that we think through, and that is that we're really wanting to support businesses and business resilience, and we've wanted to keep businesses open. And so hopefully that message is out there that actually we do have that approach. And the win for us, I suppose, is our focus is on controlling the virus spread, but it's both ways. And then, of course, on top of that, we're providing information through the council about all the support that's available through the government systems. So hopefully businesses have appreciated that too. So just, in terms of my experiences with businesses, I have been really, really impressed, and I've been really quite overwhelmed with the fact that they really are right on the case and really trying to do the right thing and doing the right, the best thing for their staff and for their customers. So really positive sense of what's going on out there at the moment. And then to the right of the slide, a little bit of a understanding of our journey so far. So 98 outbreaks managed together, and that's the definition of 2 or more cases within a business that are clearly transmitted within the business environment, within the workplace environment. We've had our fabulous environmental health and safety team going out and visiting businesses, and sometimes they're surprises and sometimes they're not, but the whole emphasis is on trying to make sure we're doing the best for our staff and our customers, etc., in the system. And then a much larger number of businesses supported in all kinds of ways. And some of that will be clearly the transmission isn't happening within the workplace, but we have to explore that with them. And there a list there then of the types of businesses that we have been working with. There won't be any surprises there, but quite a wide variety, but I won't go through them all. And one of the things we wanted to share with you today is really our learning as well from that experience as we go forward. What have we learned? And there's been a fantastic team working on this and identifying lots of lessons learned. And I'm going to hand you over to Dawn now to take us through those lessons and advice on into the future. Thank you so much. It's been a pleasure.
Good morning, everyone. My name's Dawn Burns. I'm one of the environmental health officers that work in the test and trace team, as Sue's just referred to us. My colleague Natasha will also be presenting today, and we also work with another lady called Penny. So, as Sue said, we've been investigating or visiting workplaces, I should say, over the past months to look at COVID outbreaks. And our main objectives really when we come in to see you, when we do that really, is to look at, are there any areas for improvement so that we can help you be more COVID secure? Also to learn good practice, because we'll then share that with other employers, but ultimately to keep you all as safe as possible and to keep you going, business continuity really, because we want to keep you trading as much as possible. Our experience of outbreaks is that, if they're not properly contained, then it can lead to some businesses actually shutting temporarily because of a lack of staff. So it's really important that we get in there and share our learning with you. So this morning, as I say, we're really hopeful that we can give you lots of handy hints and tips about things to make your workplace more COVID secure. Next slide, please, Chris. Thank you. So, guys, you should all really be familiar with the concept of risk assessment for general health and safety, and the COVID-19 risk assessment really builds on your normal workplace risk assessments, but obviously looking in particular at COVID-19 risk in your workplace. And it's really important you do that for your individual workplace, because you're all different. You've all got different layouts, you've all got different, members of staff, shift patterns, different activities. So what you need to do really is put your risk assessment down, think about situations within your workplace that might lead to transmission of the virus. And the more we'll talk through the presentation, hopefully we'll be able to help you with that. Think about who can be at risk. So that's obviously your staff, but any visitors that might come to see you. And then think about, most importantly really, how can you eliminate the risk? Can you stop transmission altogether? If not, then it's about putting in sensible controls, being pragmatic. What can we do to hopefully prevent transmission between your staff? And two key things I'd say here through our experience with working with employers is, you're all trying to do the right thing. And I think sometimes we're helping you tweak your risk assessments to identify areas that perhaps you haven't included. But talk to your staff, get your staff involved, and also ensure that you're training your staff in the outcomes of your risk assessment. So just a very simple practical example that I'd give you. Quite often in workplaces, we'll find that windows are all tightly shut. I mean, obviously during the summer months, this will hopefully improve. Ventilation is a key control for COVID. So if you're telling your staff why you need the windows open, then we'd hope that they'll do that for you and leave them open rather than shutting them in staff rooms and areas like that. Okay, so next slide, please. Thank you. So I won't dwell on this, chaps, because this has been a key message, hasn't it, through the whole of our pandemic, is if possible, work from home. And I fully appreciate that, the reason you're here with us this morning is that you are reopening. So the chances are you're going to have to be going back into your workplace. But if you have got staff that perhaps administration staff or support staff that can still work from home, then we'd really urge you to continue with that. Because that will lessen the pressure really on social distancing in the workplace, lessen pressure on like welfare areas. Just think about continuing with your video conferencing and meetings via Zoom, things like that, rather than meeting in person. And just remember just to support your staff who are working at home still and keep them, communicated with, and make sure they've got the right equipment. Thank you, Chris. Next slide. So this is just another basic underpinning one before we go on to more specifics, chaps. So your risk assessment needs to, as I said earlier, be site specific. Everyone's workplace is different. So when you're considering how you're going to approach controls within your workplace, you need to think about these key points that I'll take you through. So think about your entry and exit points. In outbreaks that we've investigated, these can often be problem areas. So for example, where your staff are coming into and out of the building, where there may be congestion. Think about whether or not you can introduce one-way systems that will help distance and separation of staff. We completely appreciate that not all businesses will have enough space to be able to do that, but if you can, then it's a good way of controlling things. And also then think about the controls that you're going to put in place to address areas like pinch points. So areas like that, we mean, for example, where you're going to get lots of people potentially congregating. Again, that could be clocking in areas, it could be canteens potentially around in vending machines. So you need to put in measures there to make sure that doesn't happen. So practical examples being maximum occupancies. So think about how many people can safely work in a particular area or move into a particular area at any one time. Additional signage just to remind people about the need to adhere to those rules. And practical examples that we found in some of our workplaces, some innovative ideas really that we come across, but one particular one in a large warehouse, in their office areas, they were actually using convex mirrors on staircases. they had quite narrow staircases where it was quite easy for people to come into close contact. So they positioned the mirrors at relevant points so that staff could see each other walking up and down and just prevent that interaction. In offices, think about moving desks onto fixed workstations up to 2 metres apart if possible. And again, we appreciate in smaller workplaces that may not be capable. So in the smaller ones, you need to look at mitigating measures, it's called in the guidance. Things like screening on desks, just to make sure that the COVID transmission can be prevented. And one last point on there, which is something that we quite often find in our visits to workplaces. Quite often employers are really good at focusing especially on customer facing areas, but they sometimes lose focus on the staff areas and the peripheral areas. So anywhere where you're having deliveries, for example, or where visitors are entering the building, you need to make sure that you've got COVID controls in place there as well. Okay, thank you. Next slide, please. So the next section of the presentation from myself and Natasha will look at some hopefully practical examples for you and specific things that you need to be including in your risk assessments. So next slide, please, Chris. Right, so cleaning, guys, this is an absolute fundamental and really important tool in our armoury against COVID. Every workplace really can be as clean as you like once your cleaners have been in, but as soon as you introduce your staff or members of the public, potentially you can recontaminate your work surfaces by people touching surfaces, coughing or sneezing. So we really need to think about cleaning. Poor cleaning and inadequate cleaning have been implicated in quite a few of our outbreaks, especially the larger ones where the virus has managed to transmit through quite a few staff. So this is a really key point to look at. So the frequency of cleaning, that basically it should be more often than pre-pandemic, obviously, but what we recommend is that you should have general cleaning of any touch points at least twice a day. And that should be at least at the start or the end of the day. And if you have any shift patterns within a workplace, then the additional cleaning at the beginning of the shift patterns as well. Increased frequency for any high risk touch points. So anywhere you have more people that will be touching more doorways, or for example in welfare areas where people will be touching kettles, microwaves, they need to be cleaned more often as well, and cleaning materials available for staff to use. And a really important point is think about the products that you're using. An important thing to mention that a lot of people misunderstand is that COVID requires a cleaning material that's effective against viruses. So your antibacterial cleaners, whilst they're useful for other things, won't be effective for COVID. So cleaning materials should be effective against viruses, and on their labels, if they are, they will have the standard shown on this slide, which is EN 14476. So just have a check of your labels and see what they say. Make sure your products are being used correctly, so that if you have to dilute them, they're diluted correctly, because if they're not, they won't be effective. And ensure if the product has a contact time, which many do, that you're following the relevant contact time, because again, if you don't, it won't be effective. And one thing really I'd say to you that's come out of a lot of our investigations really is to talk to your cleaning staff, really engage with them, communicate with them to understand what they're included in their cleaning regimes, and to give them a bit of training about what you're expecting. Don't assume that they're cleaning everything. So a recent outbreak in an office that led to 8 members of staff going off sick with COVID, and the office actually shut in temporarily because the other staff were in self-isolation. One of the things we think could have happened is the fact that the cleaners weren't cleaning desks or work surfaces and laptops, things like that. So it's important to understand what's included. Thank you. Next slide. So cleaning equipment, again, in our outbreak investigations, quite often shared equipment in particular has been implicated in possible transmission between staff. Indeed, one of our biggest retail outbreaks, we think The index case worked in an office and they were using shared laptops, shared equipment, and it's suspected that the other cases came from that shared use. So the key learning points we've learned, guys, that we want to put over to you really is that if you can, limit sharing of equipment as much as possible, and think when you think about the shared equipment in your workplace, think big, think small. So it could be something as big as a forklift truck, or it could be something as small as a phone, a stapler, a set of keys that you're using between you. So anything that you share must be cleaned between use. Try and reduce hot desking. If your workplace allows, try and ensure that staff have their own workstation rather than swapping. If it doesn't allow, which obviously many won't, we recommend that you just make sure you've got the right antiviral cleaning products available for staff to use before they jump on computers and things like that. Printers is another one to think about. Think about equipment that's particularly difficult to clean. So a good example are headsets. So in a retail outbreak that we dealt with, many of the checkout staff were wearing headsets, and when we actually looked at them, they had quite a few sponge components that couldn't be cleaned very well. So in those, with that sort of thing, either give out the equipment individually or try and avoid using it during the pandemic. Consider changing to touch-free systems. So again, we've seen some really practical solutions in workplaces. So clocking in machines is a good one. Try and avoid clocking in machines where staff are having to manually touch to key themselves in. In one workplace, we saw a really simple solution. They've actually defaulted back to paper clocking in systems now with pens, but they've got a pot, a clean pot and an empty pot either side of their registration documents, so that staff can use a clean pen, put it in the dirty side, and then obviously it will get re-cleaned before it's recirculated. So it's just trying to think outside the box sometimes, you know, about how you're going to sort of control that transmission in your workplace. And something I touched on in the last slide, if you are providing screening at desks, then you just need to think about making them adequate for use. So making sure they're of the correct dimensions so that they do keep people safe, but also they're of the correct materials so that you can clean them well. This slide just illustrates an office that Penny and I found recently on one of our visits, and this office actually had an outbreak, but they were actually using cardboard boxes as screens, which, whilst ingenious, isn't the best thing during a pandemic. So that they've actually changed those for us now, so hopefully easier to clean. Next slide, please. Okay, guys, so again, two really fundamental controls on this slide, and the hand washing one obviously has been key messaging to all of us at home and at work during the pandemic. But in a work context, we just wanted to remind everyone really that staff should have access to hot water, liquid soap and disposable hand drying materials. And as simple as that might sound, actually often we find that's not the case. We can find that people are using tablet soap and reusable towels, which obviously from an infection control point of view aren't good and can lead to transmission of the virus. Hot water helps because it means people will wash their hands correctly for the correct length of time. Alcohol hand-based hand sanitizers as well. We accept obviously use of, and they need to be placed around your workplace in really sensible key locations. They have to have at least 70% alcohol content to be effective against COVID. And quite often during our investigations we'll find, you know, employers think they're doing the right thing, they think they've provided the right sanitizer, but it's not containing the right alcohol content. So it's just something to check with your suppliers. A really obvious point next, but actually one that again we find quite often, just make sure that the facilities in terms of soaps, hand sanitizers, they're checked regularly and they're topped up regularly so that they're always available. What some workplaces do, which is I think a really good practice, is when they're doing their risk assessment, they'll actually draw a plan out of their area, and they'll actually indicate on the plan where they're going to have the hand sanitizer stations, so that then they can be checked and replenished, and it's ensured that particular areas aren't missed out of those checks. So that's something to think about. And again, encourage behaviours, because Something we don't touch on too much during this presentation, but something obviously key for you to think about are staff behaviours. Obviously, how they behave around the workplace can have a massive impact on potential spread of the virus. So encourage hand washing with posters, and the one that we've displayed on this slide is the hand wash instruction poster, which is available on the .gov website and also on the Coventry website, which Natasha will speak about later. Good practice is to encourage your staff to wash their hands when they arrive at work, and that will hopefully then prevent any incoming transmission as people come in and out of work. So moving on to ventilation, our key point for ventilation is if you've got access to fresh air, so if you can naturally ventilate your workplace, this is absolutely the most preferable way of doing it. This will help to dilute any COVID load in the workplace, basically, so it will dissipate into the open air. Again, we understand that many workplaces aren't lucky enough really to have that provision. So if you have got mechanical ventilation, it's really important that you think about how your system works. So if it's capable of introducing fresh air into the workplace, that's fine. As long as the system is maintained, then just make sure it's switched to fresh air. If, however, you've got a recirculation system, and I wouldn't know this either, guys, you're probably going to have to talk to a mechanical engineer or your landlords about this, but if they are circulation systems, that basically means it's recirculating the same air around the workplace all the time. And obviously during, you know, the time of COVID, if somebody is expiring the virus, it can then get transmitted around. So we're advising against recirculation systems at the moment. Next slide, please. Okay, so welfare areas, these are really key. And actually areas that in our experience of visiting workplaces to advise and support following outbreaks. Welfare areas are often missed out of risk assessment and sometimes forgotten. In fact, one of our very early outbreaks in a pharmacy type environment led to the pharmacy actually having to shut because we think of transmission within a welfare area that hadn't been properly managed. So by welfare areas, we mean kitchenettes in offices, canteens, locker rooms, break rooms, toilets, anywhere like that. The issue with these areas, we think, is that staff become a little more complacent in these areas. They're generally, you know, really focused on doing exactly the right thing in customer-facing areas and in the more formal work areas. But as soon as they go into these areas, you know, they relax a little bit and sometimes forget their COVID-safe behaviours. So think about staggering break times. Think about staggering your start and finish times as well. That will lessen the pressure on your welfare areas. And in terms of start and finish times, it will hopefully mean that different shifts will not interact, so any possible transmission won't happen between your shifts. In your welfare areas, think about spacing out seating. So the photo on the slide shows a good practice example where the workplace has calculated its maximum occupancy, so how many people can safely use that room at any one time. They've spaced out the seating, so we've got the 2 metre distancing, and they've faced the chairs in directions so that people aren't sitting directly opposite each other within the 2 metre distance. Just some good practice hints for this, chaps. What some employers will do is actually put markings on the floor of the welfare areas just to indicate where the chairs should stay, and that hopefully then will dissuade people from moving chairs next to each other. Just the other points, let me just catch up. So ensure that your welfare areas are included in your routine cleaning, that's absolutely key, but also provide cleaning equipment for your staff to use themselves. In terms of behaviours, it's really important that staff take ownership of cleaning. You can't be everywhere all the time, and your cleaning staff can't be everywhere all of the time either, so each individual needs to take ownership of cleaning and to have for them to be provided really with the right equipment to use when they need it. And then the final slide, for me anyway. New slide, please. Thank you. So this final slide just illustrates the last area that we wanted to talk to you about, which again we think is quite commonly involved in possible transmission between staff. Smoking areas. Smoking areas, again, as I've said previously, where staff can sometimes relax, forget their COVID safe behaviours. Their social distancing can go to pot a little bit. So if you do have a smoking area in your workplace, include it in your risk assessment. Make sure that it's COVID safe for distancing notices, and also I would really recommend that you're occasionally popping out there just to, you know, see what staff are up to and to remind them about distancing. And the one other thing, just to let you know about locker rooms, again, these are often really forgotten from COVID risk assessments, but in our experience, locker rooms can be quite small, enclosed workplaces. So think about maximum occupancy and think about leaving doors open just to encourage airflow in those areas. The other two slides just give you a good and bad example of a staff room. So the top example shows you that they've thought about their maximum occupancy. They've actually provided cleaning materials for staff. The bottom slide is actually taken from a recent outbreak in a supermarket. Their staff room, basically they hadn't got maximum occupancy. The window was tightly shut, and as you can see, it was quite overcrowded. Staff were sitting next to each other with no cleaning materials. So that's a really good example of a situation that can quite easily lead to transmission between staff. Thank you for listening to me, chaps. I'm just going to hand you over to my colleague Natasha now for the rest of the presentation.
Lovely, thank you, Dawn. Can you just go on to the next slide, please, Chris? Thank you. So I'm just going to pick up from what Dawn's talked about. Firstly, I'm going to talk about face coverings and how that relates to running your businesses. So first of all, it's really important that face coverings shouldn't be over-relied upon on their own for protection, but with all the other controls that we've talked about, they can help limit the risk of spread. So make sure you're aware of the legal requirements within your business for staff and for visitors, which can be different. But on top of that, think about your site-specific policy, which may go above and beyond the legal requirements. So, for example, you may specify certain circumstances where you want staff to wear face coverings. So, for example, in communal areas, or if they're away from their desk or a specific task, for example, in the warehouse, or when exiting and entering the building. And just make sure that whatever your policy is, it's really well communicated to all of your staff and visitors so that they know what to expect and just as prompts for them. And it is likely to require monitoring and reinforcement of good behaviours. So next slide, please. Brilliant. So car sharing between staff has been indicated as a route of transmission in many of the workplace outbreaks that we've investigated. We appreciate it's an area as a business you wouldn't usually ask about, but as it can have implications for the spread of COVID throughout your workforce, it really should be considered in your risk assessment and just when you're speaking to the staff as well. So give advice to avoid car sharing outside of the household bubble wherever it's possible. If it absolutely has to be done to get to work, give simple advice on how it can be done in the safest possible way. So just really simple things like opening windows, sitting as far apart as possible, in the car, wearing face coverings and washing hands or using hand sanitizer before and after the journey. And also it's important that they try and keep to the same people car sharing each day to limit mixing between lots of different staff. So try and be aware of who car shares in your business, because these people are classed as close contacts in a COVID context, which has implications for self-isolation if someone was to test positive. But I'll give more information on this in a further slide. And do note as well that this applies to all types of vehicles in your business, not just car sharing. So say if you've got delivery vehicles, it applies there as well. And then going on to customer facing areas. So obviously they're the areas open to members of the public, for example, your restaurant floors, your shop floors. They present different challenges to the staff only areas. So make sure that they're specifically included in your risk assessment. So think about things like controlling the entry to prevent crowding. So simple things like, will you have someone at the door to manage the queues, or will you use a one in, one out system? Make sure you've got hygiene stations on entry for visitors to use as well. And that's almost become an expectation now, I think, in a lot of kind of customer facing areas. Also, make sure that whatever your site rules are, that they're really well communicated to the customers. So use clear posters, signage, floor markings, and if you've got one, you can also use the tannoy system to remind of key messages. So Dawn's spoken about layout, which is really important to consider. In the customer facing areas, make sure you kind of look at where the potential pinch points can be, where it might be more difficult for customers or for staff to social distance. I mean, one example, one common thing that we come across is narrow aisles in shops, and they can be made even narrower if there's a lot of promotional items there stacked on the floor, or if there's cages, say for restocking. So try and ask staff to restock the shelves at the quieter times wherever possible, you know, when the shop isn't open to customers, and also make sure that they're kept as clear as possible with stock to prevent congestion. And just a point for food businesses, if you're doing takeaways, just make sure you've got a clear system in place for collection. So where space permits, have an area where customers and delivery drivers can wait, separate from other people. Or else, if you don't have that space, then one of the safest things to do could be to ask them to wait outside, and make sure that if you do have queues, that you are managing those. So next slide, please. So I'm now just going to go over an action plan if you were to have a confirmed or a suspected case within your business. So it's really important to plan ahead, so that if a staff member informs you that they've got COVID symptoms or they've tested positive, you know what to do in that situation. The link that's on the slide is to some action cards, which we'd really encourage you to download and follow in this event. It tells, it's kind of a cheat sheet of what to do in that situation. I'll give an overview of the key points now. So I think it's quite well known, really. If someone presents with COVID symptoms while they're on site, obviously ask them to leave as soon as possible, self-isolate at home and book a test at one of the symptomatic testing sites. If they're not at work, ask them to stay at home and book a test. What's really important is that you ask them to relay that result back to you as soon as possible, so that you know the next steps to take. As soon as you suspect that someone may be positive, what's really important is that you clean the area where they've been working to try and prevent further transmission to other members of staff. So that might be their desk or their vehicle, a till area, or the break areas if they've spent time there. In the government guidance, you'll see this is called an enhanced clean. And as Dawn's talked about, just make sure that for this clean that you're confident that you've got products that are effective against coronavirus. So look for those standards that she's talked about, and the government guidance gives more information on this. If you can't clean the area straight away, which may happen in a lot of circumstances, I'd say just keep the area clear, maybe use signage to make sure that no one else uses that area until it's been cleaned. And for the staff who are actually doing that cleaning, just make sure that they're protected. So as a minimum, they should be wearing PPE of a disposable apron and gloves to protect themselves. And then also be aware that in that situation, any waste that's created, so for example, the PPE that they've worn when they're cleaning that area, or the paper roll, that has to be treated as potentially contaminated. So most workplaces, you won't have a clinical waste contract. So the easiest thing to do, which is in line with the guidance, is basically to double bag it in a bin bag, tie it, keep it somewhere for 72 hours, and then you can dispose of it with your normal waste. If that individual comes back and lets you know that they've got a positive result, it's then important that you look for any close contacts at work, and I'll give more information on that in the next slides. Also, make sure you're keeping track of the isolation period for staff to make sure that it's fully completed, and then manage their return to work process. So I'd recommend just having a phone call with them before they return to make sure that they've definitely completed the 10 days isolation and that they're generally feeling well, so they can return if that's the case and if they don't have a fever. Also, as a business, just be aware that you do have legal duties around visual reporting for work-related cases of COVID. So that would be reporting accidents online to the HSE in the same way that you'd report any other workplace accidents. So see the HSE website for more details on this, but we can also advise if you're not sure if it needs to be visual reported, if that's the case. Can you go on to the next slide, please? Lovely. So close contacts in the workplace. This is really key for business continuity if you have a positive case, because it may be that the first case, the transmission occurred outside of work, but then you need to prevent further spread within your business, obviously, to keep the business operating and keep everyone safe. So we really urge you to do this proactively in-house for any positive cases, in addition to following track and trace advice. From our experience, businesses who tend to do this have minimal spreads in the workplace after a positive case if it's done effectively. Where it hasn't been done, it has contributed to larger outbreaks, which in some cases has required businesses to close for a number of days or even weeks, simply because they don't have the staff to operate after transmission's gone throughout the workplace. So it's really important to understand kind of the implications of this. So close contacts are people who've had face-to-face contact within a metre of someone who's tested positive, or been within 2 meters for more than 15 minutes over the working day or a working shift. It's also if they've shared a small vehicle with, so just like if they've shared a car, or a larger vehicle if they've sat near someone who's tested positive. And be aware that this is even if face coverings are worn. And for that close contact, you're looking at the 2 days before the symptoms started, or if they didn't have symptoms and they had a positive test, it's the 2 days before that positive test. And that's why it's really important that you try to adhere to the social distancing rules and limit car sharing between staff, so that minimal staff would need to isolate in the event of a positive case. So I'd recommend that to identify any close contacts at work, speak to an employee who's tested positive and speak through the definitions and see if they can identify anyone. But you can also do things like look at staff rotas to see who's been working closely together in those days. And if it's available, you can also look at CCTV, which is what a lot of businesses are actually doing as well. Can you go on to the next slide, please? So just to go through what information we may request from you, we might get into contact if we need some further information if we become aware of positive cases in your business. So for example, if there's a number of people who've all tested positive within the same time frame, and they all work at your business, we might get in contact with you. We ask for information just to give us a much better understanding of your workplace setting and your COVID secure measures that you have in place. We'll usually ask about the positive cases, for example, where on site did they work, what's their job roles, and that's to try and help us identify any links with you to see anywhere where the transmission could have happened to try and prevent it going forwards. This is routine, so it's to try and help us see if there's an outbreak situation. So if we do get in contact with you, just don't be alarmed. It's nothing to be worried about, and we're there to help. We'll usually send you 2 forms to complete via email, which are shown on the screen. In some cases, we'll then follow up with a site visit or an online incident management team meeting to decide on the next actions or if improvements are required. And I think the really key thing to try and get across is that we are there to support you and prevent or stop an outbreak in your business. So the more open you are with the information, the better we can help you and give relevant advice if you do become in this situation. So next slide, please. So I'm now going to go through COVID testing options within your business and what we'd recommend. So can you go to the next slide, please? So first of all, there's two different types of COVID tests which we talk about. PCR tests are when the employee has symptoms of COVID, and these tests need to be arranged prior to turning up at the test site. Lateral flow tests, or what we call LFT, are routine screening tests for staff who don't have symptoms. It's a way that you can monitor COVID cases among staff who don't have symptoms to prevent the spread. This is free and there's no appointments needed, and it's open to anyone who lives or works in Coventry. And it's just important to be aware that if you do test positive via the LFT route, you now need to get a confirmatory PCR test. The slide shows the location of the test sites in Coventry. This all information can all be found online as well. And the recommendation is that for staff who can't work at home, they should be having LFT tests twice weekly, which can be done at one of the community testing sites in Coventry or through home test kits. So if you go to the next slide, please, and I'll just go through some of the other workplace testing options available for businesses. So there is the national government scheme available, which you can register for if you're a registered business in England, and for your employees who can't work at home. If you want to sign up to this, you need to register before the 12th of April, and then you can either set up your own test centre at your business, or you can receive home test kits to give out to your employees to self-test at home. And then the other option, which I can announce is very soon to launch, is a new local test scheme to Coventry called Workplace Collects. So that's for staff who can't work at home, and they'll be able to pick up LFT home test kits from our community test sites. So it's a really good option, and hopefully that will be really well received. So more information and communications around this will be available from next week. We'd really encourage you to inform staff of this new option for the people who can't work at home. So see what testing works for you as a business, and really, if you're not doing it already, do think about trying to encourage your staff to have regular testing to give you a good understanding within your business. So that comes to the end of our team section. Really do hope that you found it useful. We'll be here for any questions at the end if you've got any. I'm now going to pass over to business support.
Yes, hi everyone, I'm Richard Middleton. I'm one of the Council's business development advisors in the Economic Development Service. I'm just going to spend a short amount of time letting you about some initiatives and further support that is coming. The first initiative I'd just like to highlight is the Coventry, Solihull and Warwickshire COVID Pledge. This is for businesses to help reassure staff and customers that they're operating in a COVID secure manner, so helping to reinforce the public health messages that are going out. It's going to be made ready for the second step out of lockdown, which of course is currently scheduled for the 12th of April. And of course we all know that the virus is still with us, and about half the population now has been vaccinated, but we still need to remain vigilant and provide reassurance that we're doing all we can. So this COVID pledge is designed to help with that. The pledge means that businesses will agree to work in a number of ways and agree to a number of measures to make themselves COVID secure, and then promote this to their customers. And this will be some of the things you've heard today, things like social distancing, mask wearing, hygiene, ventilation, things like that will be included, and the business will sign up to it. And once you've signed up to it, you'll get access to the business pledge poster and various materials that you can then display on your premises to provide reassurance to people entering them that you're operating in a COVID secure way. So this was announced a couple of weeks ago, and the launch is imminent. I'm expecting that it will be done next week. It has to be done before the 12th of April, of course. So look out for the announcement around the end of next week, I would say. Details will be shared with the Chamber, Growth Hub, FSB, and through the various media channels with press releases and things. So keep an eye out for it. It's something that's coming that will be particularly useful for businesses. And as I said, it helps to reinforce that public health message that we're all trying to get out to people. So can you go on to the next slide, please? So there are other business support available from the council. You may have heard of the additional restrictions grant. This is one of the ways that we've been able to support businesses who weren't able to get the more automatic grants that were available to rate-paying businesses. So we implemented the additional restrictions scheme, which gives us a bit more discretion to help companies. And we gave those to businesses who are not mandated to close, but were suffering a significant loss of income, or non-business ratepayers who did not need to close, also suffering significant loss of income. Now, we've had 2 phases of this grant, and the 3rd round is currently open until the 14th of April. If you'd already applied to one of the first 2, you don't need to apply again. But if you haven't applied for that grant and you haven't received any grant support, that's one that's worth looking at. The grants range from 500 to 4,500 per round of the grant. That's dependent on the number of employees you have and what any premises rateable values that you have, if you have any premises indeed. You don't have to have premises to be able to access this grant. So that is something that the council will continue to use, I feel, to offer discretionary support as we go into the various stages of releasing lockdown measures. A second one that's been also very recently announced by government is the Restart grant funding. So if you were automatically getting some grant payments because you were a rate-paying business that had to close, well, this grant has now been announced. It's a one-off grant for rate-paying businesses, up to £6,000 for non-essential retail businesses and up to £18,000 for hospitality, leisure, personal care, gyms and accommodation sectors. It's for businesses in those sectors to reopen safely. And it's going to become available this month. Government released the full details of how they'd like the scheme to work. So now it's up to local authorities to work out how they are going to implement it. So that's currently being worked out in Coventry right now. And the announcement of when it will go live will be fairly soon, probably imminent, I would say. And as I said, it's for those rate-paying businesses. If you're a non-rate paying business and you're in one of those sectors, keep an eye out on our web page. There's a link on the page there. A slightly simpler one is coventry.gov.uk/coronavirus advice businesses. Bit of a mouthful as well, but a bit simpler than that one on the screen. If you're a non-rate paying business, keep an eye on that, because it's likely we will look at trying to introduce some additional measures for our additional restrictions funding to help support. We also have access to European funding still, and will do for another couple of years at least. So if your business is doing anything where you're thinking about making your premises more energy efficient, or you're looking to innovate and develop new to market products, or you're making any kind of capital investment into the company, like buying new machinery, equipment, or even doing premises refurbishment, then talk to us about some of our other grant funding. There's grants of up to £50,000 available at intervention rates up to 30%, but it could be something that could be quite useful at this time. So if you've seen a gap in the market and you think, actually, I need to buy some new equipment to be able to do that, and if you think then therefore that you might create some jobs from it as well, which is one of the outputs that we like to look for, then have a chat with us about that. So you don't have to come straight to the council to access some of this support. You can use your existing channels, such as, of course, the Chamber. There's also the Growth Hub, the Federation for Small Businesses. They'll all point you in the right direction. But if you go to our main business web link page there, it will provide access to all the various different types of support that we offer in the council to businesses. But it's worth keeping an eye on that, and of course keeping an eye on the government announcements, because things are changing all the time, and new government's announcements will continue to be made. So it's always worth keeping an eye on the news every day, just to hear what government is thinking. Because often government will announce something and then it's up to us in the local authority to work out how we're going to administer it locally. So it's always worth keeping an eye on it, just so you're a little ahead of the game. Next slide. So I'm not sure if this was my slide or not, but there's some further links to some other places where you can get various pieces of advice. But that concludes my part of this webinar. Thanks.
Thanks very much, Richard. And I'm just going to stop the share so we are back in the room. Thank you, everybody. I think actually we're just a few minutes after 11, and I think we've done such a fantastic job of covering everything that we haven't had any questions come through, which is great. But I suppose, Liz, just coming back to you for a final comment, really. I think with the roadmap and with restrictions starting to ease, I suppose the message really is not to businesses is not to let down your guard almost, that COVID is still very much with us, and these measures and all of the fantastic information that the team have shared today is very much still relevant and will be probably for the foreseeable future. And I suppose that's probably part of the key message at the moment. Would you agree?
Thanks, Chris. And yeah, absolutely. You know, we are still living with and through COVID, and it's great that things are opening up. And but let's all take it really steady, is what I would say, over the next few months. Because personally, I'd like to have a holiday in the summer. I'd like to spend some time with my family this coming Christmas. So to do that, we all do need to take it steady. Can I just say thanks to my team for doing a brilliant job, because that was a really, really good overview. And I think you have recorded it, Chris, and the slides I think can be circulated. So there's an awful lot of information in there. But hopefully that will be useful to businesses who are on the call today, but more widely as well. And we haven't got any questions in the chat, but just come to us, just come through us if you want to have any queries. Well, you know, I don't know whether you use Chris as a conduit, but yeah, we're very, very happy to take questions. We'd much rather be doing preventative work with you than coming in and helping you manage an outbreak. So yeah, let's try and keep on the front foot with it. So thanks again to everybody.
Fantastic. Thank you very much, Liz, and thanks to all the teams. Some really, really useful information there. And as Liz quite rightly says, we'll share the recording, we'll share the slides, and obviously we at the Chamber here are always happy to put any contacts in place if you need to get in touch with the team. I just want to say also on behalf of the Chamber of Commerce and all of our members, thank you really to our local authorities, to Coventry City Council and to Warwickshire County Council, for the fantastic job the public health teams have done, but also the business support teams in getting those grants and that funding and that essential money out to the businesses, really, because it has been hugely appreciated and has made a real difference to a lot of our businesses across the region. So we're going to bring it to a close there. Thank you so much to everyone who's joined us this morning. We will drop an email out shortly with the slides and with information to the links that we've mentioned in the presentation. And then as soon as the recording's available, we'll share that with you as well. But please do get in touch with our colleagues at the council and also with us here at the Chamber if you do need any support ahead of the 12th of April and ongoing, both in terms of public health assistance and also, as Richard mentioned, with the support that's available either on a local level or through the government support schemes. So thank you, everybody. Really appreciate your time this morning. Thank you to everyone who's joined us, and have a great rest of the Thursday and a lovely long Easter weekend. Take care now. Bye-bye.